Everyone, it's Tiara with Beyond Type 2. Today I am joined by Megan Muñoz, who is the host of Type 2 and You, and she's also a diabetes care and education specialist based in Iowa. Megan and I are going to be chatting about the importance of CGM and time and range, particularly with the Freestyle Libre. Megan, please introduce yourself to our audience.
Hello, everybody, and thanks, Tiara, for having me on with you. It's super exciting. And my background is I've been in, basically nursing, but most of what I've done as a nurse has been with diabetes and working with people with diabetes. So inpatient, outpatient, big hospital, smaller hospital, you name it. It's been a wonderful experience, and I've really liked learning about people and what they're doing, and how they're managing their diabetes and kind of being their champion and helping support them. And so that's also why I started, like you said, the Type 2 and You with Meg podcast to help really support people with type 2 diabetes and give them access to maybe things they never had heard about or thought about, that maybe an educator could provide for them. So.
And Megan, your podcast is amazing. I know I talked about this a million times, but you really do have this human element to the way you talk about type 2 diabetes. I think when you launched your podcast, and I think this is still true, but you the only type 2 podcast that was by a diabetes educator. So you really have just set a standard for how we can talk about type 2 in the podcasting space. And we're lucky to have you on to talk about just a piece of technology that people with type 2 diabetes historically have trouble getting, which are continuous glucose monitoring devices. Let's kind of start with what they are and what they do and how they compare to BGMs or blood glucose meters. How would you describe the difference between the two in terms of data that people with diabetes can get?
Yeah, that's a really great question, because I think people maybe see them on TV or hear about them, but don't really know that they could get one and what they do. So a blood glucose meter, you basically check your blood sugar by pricking your finger, and you see what your blood sugar is at that moment in time. Like you mentioned before, a snapshot, or kind of like if you think about a camera versus a movie, it's just one picture and your whole day, but you don't know what happened before that. You don't know where that blood sugar is headed. And that's where a CGM is different, because it provides the in between the scenes kind of data. You really basically get what happens before and after that blood sugar check. Like, well, it's not a check, but if you're using your meter, you kind of, with a CGM, you actually get the info before and after. So you would be able to use that, and it measures the glucose level actually in the interstitial fluid, so a different part of your body than your blood, but it updates, most of them update continuously or every 5 minutes, or some of them you scan, like the Libre, and you can get all of your data on what your blood sugar is doing and where it's headed. And so I think it's really helpful providing like more information. Comes with a lot of responsibility, because you have more info, you got to do more with it, or you need to know how to manage that info, but it definitely provides the in-between pieces.
Yeah, totally. And I wear a Libre, so I know I have a bunch of data at my fingertips. With the Libre, you can use your phone to scan and get up to 90 days worth of data. So, and you can see just like what trends that you're seeing. So if you're someone that's higher during the day, you can narrow down, hey, what am I doing each day to cause spikes in my glucose? And we talk a lot about time and range and A1C, and I would love for us to cover what those two concepts are and how they're connected. So, what is time and range, and how is it connected with A1C?
So that's a good question, and I'm curious to see like what your experience has been with this. But time and range is basically how long your blood sugars are spending between 70 and 180. And we know if your blood sugars hang out there about 70% of the time, then you're going to be close to an A1C of 7%. And so that's really nice, because time and range actually provides something different than what the A1C can provide. So if you think about pricking your blood, your finger for your blood sugar with your meter, that's like a snapshot in time. An A1C is kind of like the trailer of the movie. You kind of get a little bit of what's going on, but there's all these other pieces in between that you don't really know the entire plot and what happened. And then you've got the CGM, which is like the whole movie scene, and you can actually be a little more proactive because you're, like you said, you're seeing what's happening, and you could change what you might be doing with your medicine or what you may be doing with your food or your activity to kind of maybe bring that blood sugar up or down, so you're staying in that healthy range, that 70 to 180 more often.
I I love how you're talking about diabetes as if it's a movie, like, that snapshot in time versus like the behind the scenes and movie aspect that the CGM provides. And in the diabetes space, we also talk about, is time and range more important than A1C? Why or why not? What's your opinion on that?
So I think it is, for a couple of reasons. A1C, I have to say, is largely still, people still largely depend on that to make their healthcare decisions, and their providers do that as well. But CGMs provide something completely different than the A1C in that we know what fluctuations are happening in the blood sugars. So somebody with an A1C of 7% could have, a good portion of their blood sugars that are way too low, and they're struggling with low blood sugars all the time, and a portion of their blood sugars that are way too high, and it evens out to look pretty great. And I've had this happen to so many people. They go see their doc, their A1C is 6.5% or 7%, but they're having so many low blood sugars but the provider's not thinking about that or assessing for that. And so this person is absolutely miserable and at risk. Their health is at risk with so many lows. But just providing on that, providing or looking just at that A1C, you can't understand those pieces unless that person is communicating that with the doctor, or they even feel those and talking to the doctor about, I'm feeling these, I'm having trouble. Whereas a continuous glucose monitor, you will be able to, there's so much data beyond the time and range that tells you what the variability is in your blood sugars, how much your blood sugar is going up and down, up and down. And that can affect your body just as much as you running high blood sugar levels. So I think that is really key. And I don't know, what was your experience with that? I'm curious. Do you feel like time and range has been more helpful for you than the A1C?
Yeah, absolutely. I think before I started CGM, I used A1C as just my primary indicator of how well I was doing. But going to the doctor every 3 months, I mean, there's so much between, like, during the 90-day period that can happen. So kind of like what you said, if I tested my blood sugar maybe 2 or 3 times a day back then, in the morning, I would probably be good. In the afternoon, I may be high. And before I go to bed, I may be a little bit elevated, but I'm not sure what's going on, in between those tests. So after, I think, I'll actually use an example when about 6 months or so after my type 2 diagnosis, um, my A1C went down to about like 8, from like 15 to 8. And I
Nice.
was like, okay, great. This is, I'm doing a really good job.
Yeah.
But what I wasn't accounting for were the times where my blood sugar was probably really, really high. And also what I wasn't aware of were probably the times when my blood sugar was too low. So I wasn't aware of, or as aware of, hypoglycemia back then. So I don't know if I got to from 15 to 8 because I was in between a 70 and 80, 71, 80 range most of the time, or because I had really low moments and I had really high moments, and it just kind of like averaged out to the A1C. I would say now, time and range does help a lot. So I also use LibreView, and in LibreView, there is I can't remember what it's called. It's some sort of indicator, but you can use that to kind of predict what your A1C would be.
Yeah.
So
Glycemic management indicator, like the
that's what it
GMI.
is. Yep, GMI.
Yep.
So I use that a lot to help me set my own expectations. And I think with time and range, it helps me understand my own glycemic variability, which I'm something that I'm always aware of, because I know that can increase the risks of complications if I'm not careful with that. So I prefer time and range to A1C, but also I think of it in a way that A1C is like the final result. So it's like the I don't want to say grade on the test,
Mm.
but it's that final snapshot of or the conclusion of that movie that we're kind of talking
Yeah.
about.
So
Whereas
it's like reinforcing what you're seeing with your CGM, it almost sounds like.
exactly.
Yeah.
So that's what time and range does for me. Um and yeah, so it
Yeah.
kind of helps me with those trends.
So you really use, and I think that's a good point because I think a lot of people think you're going to use one thing to replace the other, and each has their own place and their own importance. So like you said, it creates a bigger picture. So you're adding something to your diabetes care that creates like a bigger picture of how things are going.
Yeah, and I think with time and range, you can see what everyday impacts, well, what everyday activities impact your time and range. So yeah, your time and range could be 30% one day, and then the next day you're 60%. So for our audience, the Libra, you can get up to 8 hours of data, so you can see what your time how your time and range changes every day. But when you go to your go on the app and you can look at your 30-day or 7-day or 14-day or 90-day, you can see what your time and range has been. So that tells you what your daily activities or what kind of impact they're having on your blood glucose either that day or throughout the course of the week. Now for you, Megan, how can people with type 2 use time and range to set expectations for the 90-day follow-up? How do you counsel your patients with that?
Yeah, it's crazy because I think the time and range has been a huge game changer in expectations. Even myself as an educator, I'm always thinking, oh, should we get more healthy blood sugar? Always wondering if I need to be pushing more. And I think the time and range helps remove that perfection piece for a lot of people, that people feel I have to get more of my blood sugars in the healthy range, or none of them can be too high or too low. They really have unrealistic expectations of themselves or their body, and it can be very stressful. So I think that expectation piece is really huge, as far as setting that expectation for that 90-day follow-up. And I think the other piece of that is connecting that time and range to what the A1C is going to be. So about 10%, if you have about a 10% change of your time and range, that would equate to a 0.5% change in your A1C. So it sounds, like just little baby steps. It just really reinforces just tiny little things. Little changes can make a big difference in the A1C level. So I think that's really helpful. So if you are somebody that really needs higher blood sugar levels because you have a lot of health conditions, or you're older and you're using continuous glucose monitor, you might shoot for 50% of time in range, or that's close to an 8% A1C, where 10% difference or 20% difference from that is going to be that 70% time in range and a 7% A1C. So I think that's really helpful in kind of understanding how that A1C connects to the time and range piece.
And what are some everyday activities people can do to improve their time and range?
Oh, I love this question. Okay, and I want to know some things that you've seen as well. But it's crazy because it really is just good old-fashioned diabetes self-care. It's being active. It's looking at the food choices that you eat, and it's not demonizing what you eat, but just understanding if I eat a combination of different types of food, does that change the way my blood sugar responds versus having cereal for breakfast? What does my blood sugar do, and what do I expect of my body? And timing of meds, oh my goodness, it's so amazing to see the difference in what people recognize with, okay, now I'm timing my insulin or my pills or my my medicines at this time before I eat, and it's made a huge difference on my blood sugars. So I think, like you said, that cause and effect piece, oh, so huge, because now you can take these pieces. You can experiment. You know, I've talked about that with you before. I love for people to experiment, because how else are you going to know? And now you have this tool that gives you that feedback right away, so you can understand, okay, how is this working for me? And if it's not, what little thing can I change? So maybe if you're struggling with activity, which is pretty common, that's normal for a lot of people to struggle with that, then maybe you look at your days that you are active versus days you aren't. What is your time in range on those days? And it really reinforces the things that are working well, and you can build off of those.
I do have a question about how people who don't have a CGM but are still interested in learning how often they're remaining in those numbers. Is there a way for people who only have access to BGMs to do that? Do you help your patients do that?
Yeah, nope. I think that I have actually helped people do that more since having CGMs, that people who I work with that don't have a CGM, that just use their meter, that I use that gauge when I talk with them, because people are so much more receptive to that. And it's just more tangible, I feel like, than, you know, okay, your blood sugars should be here most of the time, or other, I don't know. It just helps create more realistic expectations. So yes, there's a way. Uh, the best way to do it, if you are checking blood sugars, is to take a 14-day span or two-week span, and you try to check blood sugars as often as possible. 2 hours after your meal, before meals, overnight, bedtime. You know, you just really dedicate your energy and time to checking as many blood sugars over that 2-week period. And then you take the number of blood sugars that fell between 70 and 180, and you divide it by your total number of blood sugars. So let's say you checked 100 blood sugars in that time period. Maybe you take, and 75 of those blood sugars were in a healthy range. So between that 70 and 180, you take that 75, divide it by 100, which is the total number of blood sugars, and times 100, times that by 100, and that equals your time in range.
That is a really great nugget to have. Like we
Yeah.
know that we want people who to be on CGM, but the reality is not everyone can. But that doesn't mean that they should be excluded from time and range. And
Yeah.
because of the formula that you gave them, I hope that there are people who are going to take that information and are going to either test more or work with the data that they do have to figure out like where they are, and that way they can still apply some of the same principles we talked about
Yeah.
learning how to set expectations for your next doctor's visit. That is such an empowering concept, Megan.
Yeah. And I'm good at math, which is good. I didn't know if you technically I had it written down, but but I would add too, like some of the meters now have apps that will go with them and that will provide a lot of that information. So so that's something you could check and see if the meter that you're using, especially if it's, a newer within the last 3 to 5 years. A lot of them have apps where you wouldn't have to go through the process of doing the math, but
Yeah.
would provide it for you.
Yeah, and they'll give you like a projected A1C. I've used apps like that before.
Yeah.
Super useful.
Yes.
And do you have patients who ever come to you and say, Megan, I'm only in range for 40% of the time. How do I, keep my perspective that I can actually manage my diabetes very well? How do you help patients move through that?
That's a really good question. And that's something that's really hard when somebody has struggled with high blood sugars for so long. I actually find most people end up not using their CGM at a certain point. They take it off because they just feel like, okay, well, I've tried everything, nothing's working. I don't want to sit there and see high blood sugars all the time. And so they end up not using it as much. So if somebody ever comes into me and they're not using it, I really want to know why. Is it because they're having a lot of alarms or whatever? Because most people find success and really enjoy it. Or is it because they've really struggled with these high blood sugars and they feel really hopeless? And I think the biggest piece is giving people that hope back. This is where you're at right now, but that's not where it has to be. And it might take a month, it might take a month and a half, it might take 3 months, but we can get there. And I'm willing to partner with you. I'm willing to support you. And let's start with a baby step. Let's start, what's the first thing we can do? And I had someone not too long ago who, her kidneys were almost like, she may end up being on dialysis, but she said it so nonchalantly, like it's not, I'm kind of like, well, I've had high blood sugars. And she's somebody who was super motivated, worked out, she had her own business, she was not slacking, but she just had given up. She had, she took her insulin, blood sugars were still 300 and 400, and she just gave up. She stopped using her CGM. And so we just worked on, if we just had a really serious heart to heart, and I said, I'm willing to be your partner. And I think if you just give it a month's time, let's just reevaluate in a month's time, and just dedicate coming week to week to week, and let's see where we end up. And last A1C she had was like 7%. I think she just needed to see, and that's the thing I think people really miss, is that like little changes like help build momentum. Little wins, you start building and building and building, and you feel more successful. You don't really do a great job when you feel like crap, when you feel like you failed, or you feel like you can't do anything. I think that's the biggest piece, is letting people know and doing one small change and comparing from when they were here last to now. What kind of change have we seen in the time and range? And any kind of change that goes in the positive direction, we celebrate. Like, I don't care if it's 1%, we celebrate because we're moving the right way, and it's, we're getting there. So yeah.
Man, that is so inspiring and powerful. I like how you use the word partner with your diabetes patients, and not just saying like, I'm gonna oversee or help. I think that partnership is so important when you're working with a diabetes patient who is just not in a good place. And um, there's a lot of talk about data fatigue in data overload, and a CGM can be that for you if you're already in a bad place. But when you have a diabetes education specialist like you, who's willing to look at those numbers and see an upside, and willing to work with your patient to identify positive things and keep moving in that direction and celebrating those wins, it makes such a big difference, Megan. And that's a good way to keep that open perspective, for people who are, right now not seeing that, hey, you may be at 7% time in range, but it really doesn't have to be that way. There are probably things that you're doing right now that are positive that we just need to do more of.
Exactly. That's so, yes, you nailed it on the head. Like, build off the positive. What's working,
Yeah.
and how can we do more of that? Yeah.
So no, Megan, this has been a really great question, a really great conversation.
Yeah.
I've been really happy to chat with you. What else would you like our audience to know about CGM, time and range, A1C, how they all fit together? If someone had to start today on making changes, or if they wanted to learn more about time and range, what are some key takeaways that you would want them to take home with them?
I think the biggest takeaway with continuous glucose monitors is that it's probably the wave of the future.
Mm-hmm.
It's probably something that you will have access to, in the next 10, 15 years, more commonly than probably maybe even a continuous glucose or a blood sugar meter,
Yeah.
or a blood glucose meter. So I think being ahead of the curve is always a benefit, and really using a continuous glucose monitor, understanding time and range. It sounds probably overwhelming if you're not used to a device. It might, this conversation might be overwhelming, but it is really intuitive and easy to understand once you dive into it. So don't let fear stop you. Don't let a lack of, knowledge or information by your medical team or yourself stop you. There is a really good site, I don't know, diabeteswise.org. And it's by Sanford Health, I believe. It's a university, and it's basically where people that use devices, pumps, continuous glucose monitors, talk about their experience, and you can compare the different devices. And you can start from, I don't have a CGM now, but I'm interested. And you can kind of look through and see what is the information, what are people saying. But don't let fear stop you, or the unknown stop you, and and go for it, and believe in yourself and trust in yourself, I think would be the other piece.
Those are some really great takeaways, and just sort of recap some of the other things that we talked about today. We talked about how CGMs and BGMs compare, and the data that you get from CGM versus finger pricks. You know, I really love that analogy of thinking of diabetes like a film and thinking of BGM as like that snapshot of that scene, whereas CGM gives you the entire film. I love that. I'm gonna internalize that now.
You can use it to your heart's content, because I don't know where I don't know if that's something I made up or I heard, but it's I feel like it's a good analogy. It makes
Yeah, it is. It really is. It makes sense. We also talked about how people who don't have CGMs can use their average glucose to calculate their own time and range percentage. And we talked about some empowering ways people can look at their time and range holistically. So thinking about it in perspective and thinking about everyday activities that impact it. So I really hope our audience has learned some new things, and I hope they feel empowered. Megan, you are amazing. Please tell everyone where they can get in touch with you and how they can learn more about Type 2 and You with Meg.
Oh, well, so you can go to type2andyou.org. That's the number 2. And you can always reach out to me that way. My email is type2andyu contact@gmail.com. Type 2 and You with Meg is the podcast. So I really do like hearing back from people, or I like hearing, people ask me questions sometimes on Instagram or on the podcast. We do diabetes dilemmas if somebody has a question. But I really love learning more about you, and so I would love to hear from you if you have a question.
Yes, everyone, please, get in touch with Meg. She is amazing. One of the best diabetes care and education specialists I've had the privilege of meeting. We also featured Meg in another article about her podcast. So please check out beyondtype2.org and go to our Life with Type 2 stories, and you'll see our interview with her. Check out our podcast and follow her on social media. To learn more about continuous glucose monitoring, go to beyondtype2.org, and if you go to our diabetes management page, you'll see we have information on CGM devices, including other personal stories on wearing the Freestyle Libre. Megan, thank you so much for joining, and we hope to have you on with us again.
Thank you, Tiara. It was great.
Bye, everyone.